UMHS med students on St. Kitts raise $45,000, organize clinics in Puerto Rico. Basseterre, St. Kitts, April 28, 2018. The tragedy of Hurricane Maria is still affecting Puerto Rico more than 7 months later. The island continues to struggle as power is restored and areas start rebuilding, but the physical and mental health of the people are among the most serious ongoing challenges, as UMHS student, proud Puerto Rican native and Med4U nonprofit founder and president Ariana Hernandez explains. Ms. Hernandez and her organization Med4U, comprised of UMHS students devoted to advocating healthcare as a human right, especially in disadvantaged communities, responded immediately after Hurricane Maria hit Puerto Rico on September 20, 2017. First, by creating a GoFundMe page, with the help of UMHS students, the Student Government Association, faculty, staff, and President Warren Ross, to raise a total of $45,000 specifically for Puerto Rican medical services. However, the UMHS students involved with Med4U did not simply raise money for Puerto Rico. These future doctors showed they truly understood the altruism required to assist people hurting financially, physically, and emotionally. Med4U organized clinics over their Christmas holiday break in 3 separate Puerto Rican communities among the hardest hit by the catastrophe: La Moca in Ponce, Arecibo, and in the town center of Ponce. Doctors have closed their offices, others are fully booked or the families don't have the money to treat their diseases, Ms. Hernandez said, pointing out why doing the clinics was so important. The first medical clinic in Puerto Rico was set up on December 27, 2017 in the La Moca area near Ponce, Puerto Rico. We provided medical services, psychological services, social worker services and nurses, Ms. Hernandez said. By the end of this clinic, we also did visits to individual homes for the critically ill. The second clinic was set up on December 29, 2017 in the town of Arecibo, Puerto Rico. Finally, the third clinic was held on January 4, 2018 in Ponce Town Center. This was our biggest one, Ms. Hernandez said. We provided cardiology, pediatric medicine, general medicine, psychiatry, psychology, social work, and nurse services. In addition to the health services, in our clinics, we donated clothing, food, water, and hygiene articles. We were able to help many people that lost everything after Hurricane Maria, and the homeless, too. Also, we achieved one of our goals, joining together students from different medical schools, PHSU, UMHS, and UCC. We shared our knowledge and gave the patients our best. Students also visited the University Pediatric Hospital at Puerto Rico Medical Center in Rio Piedras, San Juan. We were here for Three Kings Day, the Feast of the Epiphany, playing with the pediatric oncology patients and giving them gifts. Many of the families lost their homes too, while at the same time their kids were suffering from cancer. However, their hope and strength were admirable. People are in a desperate need of health services in disadvantaged communities, Ms. Hernandez said. For this reason, we are committed to keep doing many more clinics and in the near future helping the healthcare system in Puerto Rico. UMHS faculty, staff, and students raised an estimated $45,000 to help the people of Puerto Rico affected by Hurricane Maria. Donations were given to the Ponce Research Institute at the Ponce Medical School Foundation Incorporated in Ponce, Puerto Rico to bring further aid to students and communities in need during these months. A total of $5,000 was donated to the GoGo Foundation in Ponce to help them rebuild the damages that Maria caused to their infrastructure. The GoGo Foundation gives medical services to pediatric patients in Ponce. We had 3 great clinics where UMHS students and Ponce Medical School students participated, Ms. Hernandez said. Med4U is committed to keep doing these clinics. Ponce Research Institute President Kanira Thompson, PhD, praised UMHS efforts in a letter. Words cannot express how grateful we are for the support provided by you during these difficult times, Dr. Thompson said. You came to our aid with a generous donation, comforting messages, and support for our faculty, students, researchers, and ongoing activities. UMHS students have been bringing hope to other parts of Latin America as well. Just 1 month before Hurricane Maria hit, 8 UMHS students involved with Med4U and UMHS Professor Angel Matos, MD, volunteered on a mission trip to Zacapa, Guatemala, a remote, poverty-stricken area of the Central American nation with little access to medical care. Med4U organized clinics and saw more than 350 patients with various illnesses and conditions, providing people with antibiotics, antifungals, vitamins, and other medication. Throughout this trip, we saw the conditions in which this community lived in, and we couldn't help ourselves but to empathize with them and the rest of the world, Ms. Hernandez said. We took it upon ourselves to work and put out our best effort in providing these individuals the health care that every human being deserves. UMHS Med4U has scheduled medical clinics again in Latin America from April 26 to May 3, 2018. File photos of UMHS in St. Kitts.